Dear friends, welcome to another video of Inspired Sense. Today we are going to discuss about the phobias. Phobias merely refer to fears. We all have certain fears in our life. No one is without fear in our life. If a person is not afraid of tiger, that person may be afraid of a small insect like a cockroach or any other thing. Or if you are if you are not afraid of the frog or any other things, we may be afraid of snake or something else. Some people may be afraid of dogs. Some people may be afraid of climbing heights, and some people may be afraid when they are alone in the home. Some people may be afraid when they are in the crowd. So these all are the different situations people are getting fears in their life. So phobia is an irrational fear. This fear is coming into the mind of this irrational fear is coming into the mind of the person without no reason or without any kind of precautions. It comes faster to the mind of the person in which the person does not expect to be fearful. So the phobia is also paired with the panic attack. If the person is having the intensity of phobia, it will lead to panic attacks. Okay, the person may feel giddy or dizziness, and many other symptoms also people may be showing. So why phobias occur? Why phobias happen to the people? So that is what we are going to see in today's video. So phobia is always connected to a traumatic experience in the life of a person. Think of zoophobia. Zoophobia means fear of animals. Okay, especially think of a person who is afraid of dogs. Whenever the person sees a dog, he is afraid. Think that when a dog is barking and running towards you to bite you, of course we will feel afraid. But think of a dog who is tied and kept inside a cage, and still we are afraid of that dog, and we get panic by seeing that in the presence of that dog which is tied in the cage. It means we have an irrational fear or phobia for the dog. Sometimes in the previous experience or in the past life, the person might have in the past life the person might have been attacked by the dog. That's why the person is carrying still a fear inside his mind, and that fear is not enabling the person to interact with the animals with a free mind. That is why the person develops a zoophobia. Zoophobia is mainly the fear of animals. There is also other type of phobia that is known as acrophobia, that is fear of heights. The person who is when the person is having acrophobia, if the person climbs height and looks down, he feels afraid and he feels giddiness. Okay, these people have problems when they are standing on the bridge, when they are standing on taller buildings, etc. So at this situation, the people feel panic. Okay, they feel that they worry. They show the symptoms of worry, sweating and dizziness. So many other physical symptoms they show in this situation. That is acrophobia, fear of heights. The other type of phobia is agoraphobia. In the agoraphobia, it is a kind of social phobia. People have problems in facing the people in the society. Anyway, man is a social being. We can't avoid the situations of meeting people. So these people, when they face this problem, they withdraw to themselves. They don't want to face the public. This is also making a problem. The other type of phobia is known as claustrophobia. In the claustrophobia, people are afraid of closed places. When they are inside some places or in the dark room alone, or normally we feel afraid when we are in the dark room. So they feel when they are in the closed places, too much irrational fear. They may scream and make other sounds when they are in those kind of situation. It happens because the people are not adjusted with certain situations of life. How it happens? It is because of certain previous past experience. The person has to identify that with the help of a therapist or a psychologist, and how to get rid of this kind of feeling. Systematic desensitization is one of the behavior therapy we can apply to people who are suffering from phobia. In this therapy, a person step by step is given relaxation and enabled to get rid of phobia. In the first step, if a person is, for example, if a person is afraid of dogs, at the first step the person is shown the face or the tail of a dog, and it is a fear provoking stimuli for the person. So at the sight of this tail of the dog, the person may feel afraid, then remove the picture and ask the person to relax. So sufficient relaxation should be given to the person. At the next step, the person is shown the leg of the dog. So each body part of the dog is shown and enough relaxation is given to the person, and we bring that person to a situation where he can see a complete picture of a dog and enough relaxation is given, and again the person is enabled to see a real dog in life, and slowly he is enabled to pat a dog. Then if he is or she is able to pat the dog, he has come to understand the situation and remove the phobia from mind, and he is in terms with the animals. So this way, whether it is acrophobia or agoraphobia, this way slowly the person should be exposed to the situation with enough relaxation. This is known as systematic desensitization, one of the behavior therapy techniques to help the person to get rid of the phobia. Thank you, dear.